of a leader is to coach, guide, and inspire others. In nursing, they are the beacons of unwavering dedication and profound impact, guided by compassion, expertise, and a commitment to make a change. These trailblazers shape the future of nursing. In the complex fabric of healthcare leadership, nursing leaders emerge as positive change agents, promoting innovation, advocating for the greater good, and embodying the essence of transformative healthcare practice. Nursing leaders like Mary Mahoney, Lillian Wald, Lavinia Duck, Margaret Sanger, and Mary Breckinridge forge paths that resonate through time.
Mary Eliza Mahoney was the first African American nurse in the United States to complete her professional degree.
Mary Eliza Mahoney, congratulations!
Mary advocates for women of color to enter nursing, and so in 1908, she co-founded the National Association of Colored Graduate Nurses, or NACGN. She gave the opening speech at the NACGN's first national convention.
Those who are here to stand for equality and discrimination on not just black nurses, but to all the jobs out there that deny the colored people's right to work. But first, I'd like to express my gratitude towards Martha Minerva Franklin and Annabelle Samuel Thompson, who are also joining us here today. They were the ones who convened the black nurses in New York City and created this organization to help and find employment for them.
The convention wholeheartedly supported her, elected her chaplain, and gave her a lifetime membership. For many years, she worked to recruit minority nurses to join the organization. Largely because of her efforts, the number of African American nurses doubled from 1910 to 1930. Her advocacy for diversity in healthcare left a lasting legacy, and her pioneering efforts paved the way for generations of African American nurses. Lillian Wald was a pioneering American nurse, social worker, and public health advocate. She strove for human rights and started American community nursing. She coined the term public health nursing and emphasized addressing social and economic issues, not just treating illness. She believed that healthcare extends beyond the hospital walls. Wald founded the Henry Street Settlement in the Lower East Side, which provides nursing services, education, recreation, and social reform advocacy. After arriving at the immigrants' home and assisting the family, she was struck by the innocence of the poor despite their dirty surroundings.
Today is a baptism of fire. I must do something for them. I need to find a place where I can live among them, understand the struggles, and offer them help. A settlement house! That's right! I must tell Mary about it.
A sympathetic friend and colleague, Mary Brewster, together they initiated the settlement by providing nursing care to the sick in their homes. They moved to a tenement, and the mission of the Henry Settlement House was born. Lavinia Duck was an American nurse, feminist, writer, pioneer in nursing education, and social activist. She was involved in initiating the American Journal of Nursing and served as the editor of the journal for 23 years. The opportunity to publish several articles on freedom and justice. In 1890, Lavinia Duck published Materia Medica for Nurses, which is the first nurse's manual on drugs, the first textbook of pharmacology. She worked with many of the pioneer nurses in educating nursing students and insisting on raising the educational standards.
You, student nurses, have a responsibility to our society, and you are the patient advocate for all people.
Duck was actively involved in social reform movements and women's rights. She was a suffragist and campaigned for women's right to vote.
Today, I stand not as Lavinia Duck, but a voice to a countless women who are yearning for their voices to be heard and a vote to be counted!
She believed in the importance of women having a voice in society and work towards achieving gender equality. She is celebrated as a trailblazer in nursing and women's rights, leaving an indelible mark on social reform. Margaret Higgins Sanger was an American birth control activist, sex educator, writer, and nurse. She founded the birth control movement, legalizing and ensuring universal access to birth control, making a significant contribution to family planning and women's rights. Sanger believed that family planning could empower women, improve maternal and child health, and contribute to the overall well-being of families.
Ladies and gentlemen, welcome. Today marks a new era for women's health. Our clinic is here to provide information, support, and access to contraception.
The very controversial subject of birth control was tackled head-on by Margaret Sanger all throughout her nursing career. As to be expected, she had many critics, including the Catholic Church. Her legacy is Planned Parenthood that is still controversial today. She is an example of the power of public health nursing and of what just one person can do.
Well, we want to have children, but we also want to be responsible about it. I've heard stories about women struggling with too many pregnancies.
It's so wonderful that you're thinking about these things, Sarah. Family planning is essential for healthy and fulfilling life. Have you considered taking any contraceptions?
Well, I don't know much about it. Is it allowed?
Absolutely. As a nurse, I'm here to provide you information and support. There are safe and effective methods available for you to plan your family when the right time comes.
Margaret Higgins Sanger's hard work and commitment to women's autonomy have made a lasting impact on the world of reproductive rights, shaping the path of women's healthcare for years to come.
Remember, Sarah, that knowledge is power. Take time to make decisions that are right for you and your husband.
Mary Breckinridge was an American nurse midwife and the founder of the Frontier Nursing Services, a huge development of American midwifery and provided comprehensive family medical care to the mounted people of rural Kentucky. Her establishment of neonatal and childhood medical care systems in the United States dramatically reduced the mortality rates of mothers and infants. She introduced the first modern comprehensive healthcare system in the U.S. and provided professional services for primary nursing care and midwifery. Embark on a research trip to eastern Kentucky, an isolated region where women were often looked after by a self-taught midwife who relied on natural methods and remedies, like a mixture of tea and tree bark to treat internal bleeding and catnip for newborn babies. Eager to improve these standards, Breckinridge traveled to the United Kingdom where she learned new techniques and returned to Kentucky in 1925 to set up the Frontier Nursing Service, a female-dominated organization. Over the years, Breckinridge earned the trust of Eastern Kentucky's population through hard work and dedication. She trained more than 300 midwives who delivered more than 14,500 babies, and by 1939, the Frontier Nursing University was established. For her tremendous efforts in improving the life of women and children in Kentucky, today, Mary Breckinridge is known as the mother of American midwifery. Leadership is the heartbeat of change. From breaking racial barriers to championing women's rights and revolutionizing rural healthcare, Mary Mahoney, Lillian Wald, Lavinia Duck, Margaret Sanger, and Mary Breckinridge. These amazing women shaped the course of nursing leadership and history.